Hey everyone, welcome to another fun episode of the Autonomous Health Podcast. I'm your host, Anmol Matan, and with me is Dr. Arta Bakshandeh, Chief Medical Informatics Officer of Alignment Health. Dr. Bakshandeh, welcome to the podcast.
Yeah, thanks so much for having me. Great to be here.
I'll start off by asking you to maybe just introduce yourself, talk to us about your journey. We feature people who are doing interesting work at the intersection of AI, machine learning, and healthcare. And so what brought you here? And then also a little bit about Alignment Health as well, where you're driving some really important initiatives.
Yeah, sounds good. Boy, where do I start? How far back do you want me to go?
Born
I'm a,
in,
yeah, right.
yeah.
So I'm a board certified internal medicine physician by trade. I started my career as a hospitalist.
Yeah.
I'm also educationally board certified in artificial intelligence in medicine by the American Board of Artificial Intelligence in Medicine. I started my career, we can go real far back as I was an EMT on a paramedic ambulance in college, went to graduate school, got a master's degree, a PhD dropout. I got my master's in molecular genetics. Epigenetics and genomics was also very interesting to me. Decided I want to go to medical school. Went to medical school, did my residency at LA County USC here in Southern California, which really taught me a lot about the diversity of people and diseases. You'd see things that typically you don't see in common practice, and I've never seen since I was in residency. And I've always been a kind of a tech, kind of guru, and I was the first person on rounds as a med student to have an iPhone and Google things during rounds, and people thought that was like, what is this device? And I remember that now, where it's just such commonplace. And always very interested in artificial intelligence. So I think it's just been a natural progression to where I am today, working with the data science team at Alignment, still practicing physician in the hospital, but really bringing context in the medical data to the data science team as a partner to help us build machine learning models that help us really take care of.
Yeah. And was there a point along that journey where you were, and between the iPhone being launched in say 2007 and all of us seeing like Steve Jobs have that incredible presentation, if you remember it, right? To today, was there a tipping point where it was like, hey, this is real? And that for you in your personal journey as a
Yeah. So 2015 in San Francisco at a conference was the tipping point for me. And at that conference, it was a gentleman by the name of Dr. Anthony Chang, who's a pediatric cardiologist at Children's Hospital in Orange County. He was giving a lecture about artificial intelligence in medicine. And he had gotten his master's degree in data science from Stanford and was articulating how he had essentially had a machine learning model overlay a echocardiogram with a cardiac MRI. And at that moment, looking at that on the screen, it was a click in my head of, this is real. I need to learn as much as I can. I don't know that I'm going to have the opportunity to go back to school right now, but I'm going to read everything I can do, go to as many conferences as I can, and start talking to the organization about, do we really go this route, and what do we need to do to get there? And I'm happy to speak to that aspect of having to change the data architectures at the health plan to be able to do what we do today.
Yeah.
Because without that, we wouldn't be able to do true machine learning.
Yeah. And can you talk about Alignment Health Plan as well? Just a quick introduction for people who are listening and aren't. I know it's a very well-known company, but just making sure everybody's aware of what you guys are doing.
Yeah, absolutely. So Alignment Health Plan, we are a health plan in 6 states currently. We're Medicare Advantage only. We were founded in 2013, so we're 10 year, going on our 10th year.
Yeah.
And the idea was, how do you bring data and a care model to the senior and aging population in a way that we can provide better outcomes, a more personal experience, understand that population, and really drive a better outcome for our senior population? Because at the end of the day, that's our grandparents, our mothers, our fathers, right? And soon, some of those of us who are listening, it's going to be, it's us already. And the thesis was that, and we are a publicly traded company under the ticker symbol ALHC. There's really nothing you can't find out about us publicly that's not there in our quarterly earnings. We've been public for about 2.5 years, going on 3 years now. And yeah, so excited to kind of talk about our journey of changing our data architecture as a health plan around machine learning models that work. And I'm kind of the stickler in the room whenever I get a call from somebody like, hey, you want to check out our AI, is we're doing real machine learning, not 1990s machine learning, which was rules, right? It was if and then this.
Yeah,
And there's a lot of that, I think, in the ecosystem in healthcare right now, where a lot of people are saying, oh, yeah, they're touting by a .ai or a .io at the end of their website. We do AI, and you get under the hood and you go, no, you're not.
yeah.
You were 30, based on definitions 30 years ago. But today, I think we're in a much different place. So I'm excited to talk about that.
Yeah. So I want to hear more about your work at Alignment and everything else. But before that, actually, I just want to hear your thoughts on the health plan industry as a whole and where they are in AI adoption, because I think that'll really kind of tease out the contrast of your thinking. If you look at the broader industry right now, a few hundred health plans in the country, where do you think they are on their, and let's call it true AI journey, true machine learning journey, deep learning, maybe more generative AI in the last 6 months? Where do you think they are? Is it something they're curious about? The rest of the industry, does the industry understand the impact of these technologies? Does the industry believe these actually are just sort of like little side interesting projects? Like, where would you benchmark the awareness or the attitudes around these technologies in the broader industry?
I think if you looked at 5 years ago, most of them weren't paying attention. If you look at 3 years ago, they probably had two or three VPs of hype, as I like to call it,
Yeah,
that were like AI, AI, and they're like, yeah, I don't know.
yeah,
I think with what I see now, and where it's getting real is since OpenAI came out with ChatGPT, I think that was when a light went off in a lot of health plans. That's not to say that there weren't health plans out there that were doing machine learning and, in some cases doing it well.
yeah,
Overall, I don't think most of the health plans in the country could actually harness artificial intelligence appropriately because of their data architectures. They still live in siloed environments, they live on SQL servers. Even if they added Spark, right, it's still not going to be in a place where they're having the ability to do it. To migrate that data to a cloud native environment, could take, in some cases, years, depending on how much data they have. But what I'm starting to see is now they're starting to take it a lot more seriously, from the bigger payers down to the smaller. You have some of the bigger payers who are using Teradata and Snowflake to bring and try to aggregate their data and do some analysis around that and some machine learning algorithms there. You have others that are using it in claims. You have those who use the RPA technology, which we can have a whole sidebar argument of,
yeah,
is that
yeah.
really AI or not,
Yeah, yeah,
right?
we'll come back to that
Um,
one. I have
yeah,
questions
well,
about that
which
one
one?
too.
Well,
Yeah,
we can just
yeah,
put that one to the side.
yeah,
I'm
yeah,
sure there's some people cringing. The RPA people are cringing on the other side, but we'll put that to the side.
yeah,
And then, from the standpoint of, is the adoption happening? I think with large language models and open AI, yes, I think we're starting to see a lot more of that. I think the use cases are on the non-clinical side very apparent in member services, in the financial side of it, and being able to query financial data very simply. I think that it's very, on the clinical side. I think most of the larger payers, they delegate risk down to other entities. So I don't think that the payer necessarily is thinking about that type of thing
yeah,
there. Payers like us that are kind of payer providers, you have, like, someone like Kaiser, who's a payer provider, right? There I think we're thinking more on the clinical side of, how do we impact clinical outcomes, and clinically using these different models and wrapping around care plans to be able to actually engage the membership, understand the membership that's accelerating or decelerating on a daily basis, and then what is the next best action for that person.
right.
And so I think it's really it's a mixed bag of what's out there. But I'd largely say in the last 6 to 8 months, OpenAI has opened the eyes of a lot of
Yeah.
bigger insurers that, wow, I really need to look at this.
And I've seen the same trend too, and actually happened to be at AHIB where some folks from Alignment had a presentation, and I remember there was a session on like ChatGPT, and like the entire room was filled up,
Yeah,
right?
yeah,
And this was, I think, a couple of months ago, and it was all peer people, and it's kind of interesting, and I've been asking myself what changed, because it's like the complexity of these models. I mean, figuring out deep learning models for clinical pathways. I mean, the work has been happening over the last decade or 2 decades, right? There's a number of advances, and then the only answer I can come up with is something about a chat interface that feels human like,
yeah,
that helps people finally relate with AI,
yeah,
and that's finally speaking to a much broader healthcare audience, health plan administrators, clinical folks who are on the ground, right? people who are doing billing and claims, all sorts of things that they couldn't understand. It didn't speak to them before, and suddenly this new example, this new interface, speaks to them in the way that maybe science fiction had taught them it would occur.
Yeah, I think you're hitting on a really important piece of why I think people adopt it is because we can very easily fall into a symbiotic relationship with it. Right? People who have over the last several years have told me, "Oh, AI is it's just all hype, it's that and the other." I always say, and I've said this before, so for the sake of sounding redundant here, I apologize to anyone who's heard me say this before.
Yeah, yeah,
Is I'll ask them, what's in your hand?" They go, "My iPhone or my Android." I'm like, so you have a symbiotic relationship with artificial intelligence today, right? You talk to it, it dictates for you, right? You're looking things up. There is some level of AI there that you are integrating, and you have that symbiotic relationship. And I think that relationship and why, from a I think a human perspective of why we're and behavioral of why we gravitate to the open AI is it's giving us the answer we want quickly. It's easy for almost anyone to really be able to use. It's just you're asking a question, but it's conversational, which you're not trying to pull down tabs and look for a report and
yeah,
right and do all these things and do a pivot table and this that and the other where most people don't have that expertise. And let's say in Excel they could easily just ask a chat gpt, hey, can you do this for me, and there it is.
yeah,
And I think that is a big reason why people are adopting. It's the trust issue that you have to worry about in terms of, do you trust the data that's there? How do you know what data it was trained on in the first place? And I think
yeah.
that's what it could be again another discussion around. Do we need report cards of hey, if before you use this artificial intelligence, know that you're interacting with it, but secondly, know the data that it was trained on and up to what time period, so that you have
100% agree.
right
Yeah.
have a better idea of should I trust this, should I not trust it, and not just take it as truth.
I think that's absolutely, and I think that's a whole. We'll come back to that fork in the road a little bit later. But I want to. So we spoke about where the industry is and the shift that's happened.
Yeah.
Now, obviously, you and the team at Alignment have been investing in this for much longer than the last 6 months. It's been core to your mission. Tell us about the investments you've made, the capabilities you have today. How is Alignment putting AI and machine learning to work? So let's start there.
Yeah. So back in 2013, we acquired a health plan that was failing, and it was that's a long story short. Legacy SQL servers, siloed systems, and I was brought on to build this command center. This whole idea of a command center.
Yeah.
And as I spent several years, just about 2 years of building hundreds of thousands of rules, the system would break every couple of months, because you just, when you're running that many right rules
Yeah.
out of a SQL
Yeah.
server, it
Yeah.
tends to collapse.
Yeah.
And the took a step back and said, okay, if we want to really differentiate, this is now 2015, 2016, and we really want to build this command center and we want to be serious about it, we need to move to a cloud native environment. We need to take on, really the way that the Amazons, the Googles bring in their data and, ingest data, transform it, enrich it, right? And then put it into a unified data platform and build APIs out of that to all of the ecosystem so that we can then, have the data in a near real time fashion, but also understand that a report in this system is going to reflect the data that is in another system so that those silos are all now part of a single pipeline. And we went through some due diligence there. We decided to adopt the Microsoft Azure environment. We then, over the course of about a year, because we were small and could do it as a smaller health plan, we moved our entire health plan 100% into the Azure environment and started to build our capabilities and what is now the Ava Command Center out of that cloud environment. There's over 35 applications today that help clinical and non-clinical folks do their jobs. There's over 200 machine learning algorithms. So again, machine learning being defined as XGBoost, neural networks, NLP, OCR, and now LLMs. Right, and those models are there to not only understand the population on a day-to-day basis, rising risk, those types of things, but also things like claims anomalies or um, next best actions and inappropriate usage of services and those types of things.
Yeah, and
Uh,
Dr. Bakshandeh, could you help us give us an example or two of, what is a kind of application that's using machine learning or AI in like a day-to-day use case that an alignment plan member would have experience with that they wouldn't have in any other setting?
Yeah, so let's talk about how we stratify the population on a both a daily and a monthly basis. So we stratify the patients using an XGBoost model. There's a lot of pieces to that XGBoost model. It's really technically two models, but I don't want to get it too deep into it.
Yeah.
There's a stacking model, and you've got some exponential decay on certain pieces of the data. Over 850 different attributes, looking over a 2-year period of time. It's not just claims based. It's looking at social determinants of health, behavior, all of that. And it's looking at the likelihood of admission in the next 30 days to the hospital on the entire population, new and old. We don't wait, for a year worth of data to be able to do it. And what we look at is we then stratify the top 10% of that population. And so let's say if it's a 100,000 member, that's 10,000 people. Those are 10,000 people we proactively try to enroll in our 24/7 concierge service. And even if they don't enroll, if they call to do a virtual care visit, Ava's telephony will reroute them to an on call clinician at our institution, not at an outside institution like, which you're very familiar with, Teladoc, right? Or MD Live or others, right?
Yeah.
And the reason for that is largely because that top 10% that we believe is very likely to be admitted, the precision and recall in that is actually quite good and better than what we've seen in the market. So, what we have made public to date is that our recall in that top 10%. So, for those who are not as machine learning savvy, right, that's how many people in that top 10% were actually admitted to the hospital. Of our admits were found in that
Yeah.
top 10%, right?
Yeah.
It's 55% for the last 7 months, and that's after our version 3 of the model that we built, and it's kind of trending at between 54 and 57% recall. So that then tells me, okay, I'm going to provide that person with this 24/7 potential care of when they call in, they're talking to an alignment physician who may not have ever met them before, but because I have all of that data in the unified data layer and these visualizations within Ava that have the near real time pharmacy, lab, claims, all of the data in front of me, the EHR data, I can then understand this person's social determinants, their utilization patterns, their who their primary is, who the specialists are saying, what their disease propensity is, all of that, and then give them a really meaningful virtual care visit in an urgent or non-emergent care type of environment where I don't have to say, what, I'm dependent on your health literacy, maybe it's not very good, you're too complicated, just go to the emergency room.
Yeah.
Right, that's not helping
Yeah.
anybody. And what that's helped us drive is our overall ER utilization as a company is 48% fewer than Medicare fee for service in 2022. 37% less hospitalizations than Medicare fee for service in 2022. 26% lower readmission rate than the national average. So these are all big numbers, which at the end of the day have financial impact, which right you need to run your business. But at the end of the day, these are also human beings who aren't sitting in an ER for hours upon hours to try and get care. They're not being admitted to a hospital because they're sicker than they needed to be because someone was able to get in front of that. And I think virtual care has really brought us to that. I think it's here to stay. It's something that is allowed us to not only with this data architecture and the AI and ML being part of that ecosystem and that visualization of it, because it's not very easy to see in an EHR,
Yeah.
as many of us know, and it has to be explainable. We have to have the explainability of why, right, an ML model is saying, this is why this person is likely going to be admitted, which may give the clinician some idea to not only what the data set was, but also what might I need to do, or is this a frequent flyer versus a high disease burden versus did something recently change for them? Did they start all of a sudden getting picking up a lot of opiates because of dysregulated pain, those types of things? And interestingly, those hundreds of thousands of algorithms that I had talked about earlier in our discussion,
Yeah.
those have become very strong signals for the ML models, which is fascinating to me because we continue to let them kind of run wild in terms of
Yeah, and just for the sake of everybody listening, you're talking about the clinical rules algorithms that were kind
right,
of
right,
created
right,
using
right,
the SQL kind of
right,
joins and things in
right.
the first iteration of this, in the prior incarnation of this.
Correct. And what we've come to realize is that it is literally codified medical knowledge and context to different pieces that maybe the AI and ML can do, but there's not enough of it, right, happening to where it's bringing those pieces together. I feel that we've created these algorithms to then say, okay, if a person has cancer, right, and all of a sudden they're picking up more opiates, they likely have some progression of disease, right? They're out of control in their pain. Having that type of an algorithm now be picked up by the AI as in the machine learning algorithms to say, hey, this is a strong signal because it's contextualizing some of those data points for the ML model,
Yeah.
which has been fascinating to watch and see, and it's helped us accelerate.
It's giving you a shortcut to the feature engineering that you would have to do otherwise.
Exactly, exactly. Yeah, when that
Right.
pops up in your top 5 of feature engineering, you're just kind of like, oh wow,
Well, yeah,
right?
yeah,
Those things we did those almost 10 years ago were not a waste. They were,
yeah,
and
yeah.
right,
And in my experience here, having worked in some of these problems, class of problems, it's sort of like the clinical intuition is paramount, right? And so what you described early on was the partnership between the clinical expertise and the intuition there and the machine learning and AI systems. Because as a technologist, I've often made the mistake of you start looking at data and then you don't quite understand what's happening in the condition with the person.
right,
And if you just spent 30 minutes with a person who actually understood the clinical side of it, that would make a much better model. That would make much better features. That would
yeah,
jump you sort of 3 steps ahead.
so true.
Right. And so often when these systems fail, it's like we just didn't invest correctly up front in a cross functional team. And I think that's a whole other sidebar, like how do you attract people who want to work cross functionally, both engineers and AI people, as well as clinical people and product people. So I think we'll come back to that. Right. So that was super interesting. You gave great examples there. Talk to me about something that you sort of hinted at, and I'd love for you to expand on this need for a new kind of data architecture, data platform, and it sounds like part of the innovation here was you couldn't do it obviously with there's the shift to cloud and shift to Azure and all that fun stuff that you mentioned, but is there a new way about thinking of data platforms for a health plan? Because I think this is a new way of thinking about stuff in the plan world. I mean, tell me if I'm wrong, but I don't think there are plans out there de-architecting, data infrastructure. Maybe a few of them are, but the majority are using sort of pretty standard, off the shelf, well established platforms here.
Yeah, I think you're absolutely right. I mean, you have kind of the newer quote unquote tech enabled, right, that are building infrastructure in a cloud native environment.
Yeah,
But the larger ones, I think they're realizing they need to make a shift. And I think in some respects they're trying to, but just I think the sheer dollars of how to do it is gonna it's a massive undertaking, right? They've got millions of members, they've got billions of data points that they've got to migrate over. So I certainly think they're thinking about it. Whether or not they're going to do it, and as I alluded to, I believe from my understanding, from United's using Teradata and Snowflake to try and put some of this data together. They're just doing claims dumps into them, to try and do some of this ML and AI, but they're still using those architectures. And speaking to some of my colleagues at other payers, they still tell me that a report that takes me 15 seconds to run here still takes 3 to 6 weeks to get back where they are because of the environment that they're still living in. So
yeah. And I mean, I almost have always wondered, right? And I think this is where a lot of large healthcare organizations, and I say this in sort of, with great admiration for people who build great companies and learning from them. But I think a lot of the successful healthcare organizations are truly kind of healthcare companies, right? So they understand actuarial science really well, they understand clinical care really well. I think it's a different mindset to embrace being a technology company.
absolutely.
And some of them have made the shift successfully, but many of them are kind of looking at it and sort of puzzled and saying, like, how do we become? And then part two is, do they need to become,
Yeah.
right? Or are they going to be platforms that come in and fill that gap
Yeah.
in the next decade or two? And how does that work? But you're absolutely right on that point, I think.
But I think the other piece of this is that's why it's we're kind of ripe for disruption, and I think in a way you're seeing a lot of the larger kind of tech players move into the healthcare space, right? You have Amazon, you've got Google, you've got Microsoft. Microsoft just I think it was just the last couple of days or maybe week that they had announced that they've got a new product in the Microsoft Fabric and Azure, which will help physicians, right, by taking lab data, pharmacy data, claims data, and what they were describing. I'm like, oh, you guys are describing Ava. That's interesting.
Yeah.
They're also bringing in imaging, and then a lot of unstructured data, which I think is incredibly important. And pulling out that unstructured data is where a lot of the information lives. in EHRs. And so you're seeing more and more of it, and I think the answer is yeah, it's going to be a platform that a lot of the payers and even the provider networks adopt. It's not, for sake of not being shot by an EHR company, but I'm going to say it anyway, right? It's not going to be the EHRs. A lot of people think it's the EHRs, and
Yeah.
I'm not sure. I think some of the EHRs have to make a pretty strong pivot to get to this point.
Yeah. And then I want to go back to, and I agree with you. I feel like we've left a lot of breadcrumbs
Yeah,
in this
yeah.
conversation. We probably run out of time to come back to them all. But I want to go back to like being an executive inside a health plan, right? How do you justify the economic investment? And I think the data infrastructure is a little bit easier to make a case for in my past experience, because you can be like, hey, look, reports run in a week versus reports run in, 2 months, right? I think that operational stuff becomes a lot easier to justify as an investment pathway. But if you go down the AI and the machine learning and risk stratification, identifying people and why we shouldn't be doing this just with clinical rules, but turn on a deep learning model, how does a plan or a large organization kind of justify that economic investment? And what does that translate into at the end of the day from a business perspective?
I think the first thing you need to do is come up with a use case and then develop the ROI around that use case and prove that out to your CFO and the organization. And as soon as you bend the ear of the CFO and show you can save money, that person becomes your best friend. And they want to know what's the next use case
Yeah,
where we can do this, right?
yeah,
And you kind of go down the list of, okay, what's next? What's next, right?
yeah,
Is it scaling your current, users so that users meaning your FTEs so that you don't have to hire more FTEs later? Is it that you're now bringing down, in our case, medical costs or something like that?
yeah,
Yeah, it's interesting. Well, the first one that we did was the admission model that I spoke about. And we said, look, we think we can bring down emissions by 5%. And if we did that, this is the dollar amount it equates to. I think at the time the average admission cost $14,000 on average. So if you could bring down 5% of your overall, it was, I don't remember the exact number, but it was a lot of money.
right.
And to get there it's not that expensive. It was like an 8-to-1 ROI. We said, okay, let's try it, and turned out we did much better than 5%, right? And it was like, okay, well, now what's next? And you kind of gone down the kind of checking boxes of, okay, well, what's the next thing we think that's inefficient? Where can we drive efficiencies in the organization around building ML models? Is it claims anomalies? Is it inappropriate claims that should have been directed directly to Medicare, for example, as opposed to the plan itself? And identifying those using ML models and then putting them in front of a end user, whoever that might have been, let's say someone on the claims team or someone on the clinical team, and that then allows them to do their job better, more focused, and understanding what they need to do. You see that in other places, in hospital systems now that are adopting a lot of the AI around radiology. The whole idea was, right, I remember in the beginning, it was, oh my God, is AI going to take the jobs of a radiologist? No, absolutely not. What it's going to do is make the radiologist's life a little bit easier. It's going to bring up to the queue that, X-ray number 100 that they are still on number 21 that has an anomaly that they need to look at,
Right.
right? And bringing it up to the queue so let them spend more time on those abnormalities as opposed to the normal, right? Well, they still have to go through it. And a human should check it all off still. I mean, we're not in the world of singularity yet. We don't have
Yeah, yeah.
general intelligence yet. So, if humans still needs to be part of this equation to say,
Yeah.
yes, this is in fact.
By the way, yeah, I heard a really good way of this general intelligence thing described last week, and so I'll come back to that. Again as a fork. But so this is super. I mean, so this is a great view of the world, right? So it's like find applications that drive value, understand the economic ROI, invest in it, build credibility inside the organization that shows it's working. So that's awesome, right? So that's a great playbook here that you described that I think all of us inside healthcare organizations should learn from. I want to switch to then the last 6 months, and maybe this is starting to talk about the hype versus the reality in AI a little bit,
Yep.
right? And so we've seen this generative AI thing. There's a ton of investment on the venture side moving into the market. I mean, even on this podcast, we've had a couple of few episodes have gone deeper into LLMs and applications in healthcare, and interesting companies doing fun stuff there. There certainly are use cases when it comes to some of the clinical content stuff, prior auth, feeding data back into systems. Where do you see, as from a plan lens, where do you see the use cases when you think of the next maybe couple of years, right? So maybe the shorter term horizon, where do you think the real use cases and where do we think we're still early? Because like you and I discussed earlier, applying things to healthcare context, like the clinical side in particular, the safety and the risk bar and the way we design those systems has to be done really thoughtfully. What's your take on the kind of last 6 months of what's happened here?
So I think the world of LLMs is very exciting, especially on in this healthcare dynamic. So first place I see it is your ability for a consumer to interact with an LLM around their care, not in the sense of I'm sick, what do I need to do, but who's a doctor in my network? Can I go to this urgent care? If I was to go to this hospital, what would be my copay as opposed to going to this other one? So being able to do what would normally be a member service function, or them having to call, wait for God knows how long, to talk to a representative, which would then be in four different screens typically, right? Looking for information. I think that now creates an interface where they can ask the questions, right? It's a narrow LLM where the LLM only sees the data within that ecosystem that's pertinent to right that plan or provider network, and they get what they need. I think that's one big one. The other is on the side of let's say it's not facing the member yet, or they're not that tech savvy, they don't have access to that. When they're calling in, the member services person has that ability to look at that information. I think that's going to be some of the very quick wins around this. I think even on the sales side of brokers being able to utilize something and say when they're looking at if I've got a member who has these chronic illnesses and is on this medication, what is the best Medicare plan for them, or what is the best commercial plan for them? Having that ability as well, I think will save tons of time on that there on the healthcare side. And then on the financial side, as well, of being able to query an understanding of where do I have high movement today, or what do I have high cost utilization, and gaining some insights there, where I think a lot of those are available today in the sense that if you look on the report you can see it, but I don't know that everybody knows how to read one of those reports, right? And in the larger organizations, you can find people who are asked to go look at one of these reports, and maybe they don't really know where to look, or maybe they just didn't realize that, hey, on this line there's this specific jump in a cost, but they don't, no one's noticed it yet. You can kind of ask an LLM that type of thing, bring that up. Why was that? And start asking questions, and help you do some of your detective work where you take it back and actually action it as a human. I think LLMs are, depending on what you decide to feed it with, to a degree, the sky's the limit, with the exception of clinical care, because of if you get it wrong, someone dies, and I don't like that,
Yeah.
right? And so you got to be really careful around that aspect of where we're.
Yeah, and I think the guiding philosophy around LLMs and Gen AI is like find the use cases that are use cases today. So I think I was at a conference recently, and Elad Gil, who's famous VC, but also has started some interesting companies. Kind of his whole pitch to everybody was like find the easy use cases for today, because
Yeah.
I think
Yeah.
I think it's sort of like the browsers of like 1999. Exactly what's going to be possible with the underlying models in 5 or 7 years, we just don't know yet.
Yep.
And I think companies could spend a lot of time and money and effort trying to like go after like a future use case versus going after one of these things, as he put it, that exists today. So I think that's a great positioning. Well, Dr. Bakshandeh, I wanted to thank you for this incredible conversation. Thank you for joining the Autonomous Health Podcast today.
Yeah, thank you for having me. That's been fun. Yeah, thank you.
All right. Well, thank you, Dr. Bakshandeh. This is your host, Anmol Madan from the Autonomous Health Podcast. Bye.